This coming Sunday marks 2 years since the first case of COVID-19 was confirmed right here in Oklahoma.
News 9's Tevis Hillis is taking us on a week-long journey about how far we've come as a state and what is next. Today, she sits down with OU Health's chief COVID expert, Dr. Dale Bratzler.
If we could have predicted on that day when the first case in Oklahoma was announced, we would have been telling people potentially there was going to be 1,328 new cases every single day, and 20 Oklahomans are going to die every day for the next 2 years.
A virus that has taken Oklahoma by storm as we're about to enter a third year fighting it. Dr. Bratzler with OU Health says he believes if we could have known what COVID was going to be like, it would have changed the outcome.
I remember when we were having meetings in June, and we were down to 3 cases per 100,000 population per day after that first really big wave where we had all the cases. We were feeling so good. In fact, our conversations were all about dropping mitigation.
This past year of 2021, we welcomed vaccinations into our prevention strategies, leaving many health officials to believe that was the answer until the Delta and Omicron variant slammed into the public. Now, as many believe we're past the worst of it, the state still sees more than 1,000 cases a day. To break down those numbers even more, for every 24 reported cases, one person is hospitalized. For every 70 reported cases, one death occurs. Dr. Bratzler says while we might be entering what people think is an endemic phase, it's difficult to really know what that means.
COVID-19 is not going to go away. We're going to continue to see patients get infected. We're going to continue to see small outbreaks.
Now, 2 years later, is how do we roll back on those mitigation strategies that were already put into place? In the studio, Tevis Hillis, Oklahoma's own News 9.